In this video, we're going to perform a treatment demo for dual task gait activities for mild dementia.
Hi and welcome back to Physio Mentors. An article by Susan Hunter and colleagues published in 2018 supported the use of dual task gait activities to address deficits in cognition and gait in patients with mild dementia. By working on multiple tasks simultaneously, a specific cognitive load is placed on an individual as they walk. This allows us to observe any deficits in their gait pattern, such as changes in gait speed, cadence, or stride length. Okay Dale, so now we're going to be doing some dual task gait exercises, but before we can do so, I'm going to have to go over a few things to make sure that we can do so safely. Okay, so the first thing that I want you to do is start at 100 and count down by 3, and just keep doing so. Okay?
No problem. 100, 97, 94, 91, 88, 85, 82.
Okay, now the second task we're going to be doing is you're going to be walking along this path for me. It's about 6 meters in length. While you're walking along this path, your wife and I will be behind you to support you, just in case you stumble or lose your balance. Do either of you have any questions before we start?
Nope.
No. Alright, perfect. Alright, so first we're going to be walking towards that red line. Once you reach the red line, you're going to turn around and then come back to this blue line. Sound good? Alright, whenever you're ready. Perfect, how was that?
Good.
Another article by Susan Hunter back in 2017 mentions that adults with early stage dementia may have subtle gait changes that make identification of deficits difficult. Dual task gait activities are a great workaround for this issue, because as an individual becomes more cognitively occupied, they will compensate by either doing the cognitive task incorrectly or displaying changes in their gait.
Alright, so now we're going to be putting 1 and 2 together. So we're going to be walking the exact same path, going to that red line, turning, and coming back to this blue line. Except now we're going to be adding some subtraction. So I'm going to ask you to count down by 3, and this time we're going to start at 50. Do you have any questions?
Nope.
Alright, whenever you're ready. As like always, I'm going to be supporting you from behind, just in case you need any help.
Okay. Okay, so 50, 47, 44, 41, 38, 35, 32, 29, 26, 23.
And how was that?
That's good.
Alright Dale, so now we're going to take it a step further. We're going to be walking the exact same path, red to blue, except now we're going to be doing harder subtraction. So let's start at, let's say, 140, and subtract by 7 each time.
Okay.
Alright, once again I'm going to be supporting you from behind, in case you struggle. Other than that, away we go, whenever you're ready.
Okay. 140, 133, 126, 119, 112, 98, 91, 84, 77, 70.
Awesome. How's that?
A little harder. That is why it is important for the secondary tasks to be sufficiently challenging for the patient, so that they are working near the limit of their mental capacity. It is also important to recognize that each patient is unique in the sense that not all tasks challenge patients in the same way. Each task challenges different domains of cognition and can affect certain individuals more or less.
Alright, and just to change gears a little bit, now we're going to be walking the exact same path, just like before, except now you're going to be naming animals. They can be whatever you want. Just as you're walking, name any animal that comes to mind. Once again, I'll be supporting you from behind in case you do struggle. Other than that, whenever you're ready.
Okay. Dolphin, wolf, giraffe, squirrel, octopus, lion, monkey, tiger, fish, giraffe.
Perfect. And did you feel like that was harder or easier than the counting by 7?
I feel like that was easier.
Alright, now instead of a cognitive task, we're going to be having you walk the exact same path, except we're going to be having you hold the plate, the palm of your hand, and balancing it, making sure the water bottle doesn't fall as you're walking. You have any questions?
Nope.
Alright, I'll be supporting you from behind, like always. Away you go whenever you're ready. And how was that?
It was a little harder.
Alright, so before we leave off, do you guys have any questions?
Oh yes, so I understand that Dale is doing this in the clinic, but are there any exercises that you could do at home?
Yeah, absolutely. So we went over the dual task, obviously, but we could be doing sit-to-stands. I'll give you some time to write it if you do need. I can also give you a fact sheet just in case you need before you leave. So sit-to-stands, we could do some tandem walking, which is just walking with your heel, touching your toes each time, looking straight ahead. And we could also do some high marching. So doing knee-ups on the spot. If Dale does need extra support, I suggest having a chair to hold on to. And then obviously while he's doing tandem walking, he could have some support behind, just like how I did during the dual task gait activities. So those are the 3 that I would recommend. Obviously you can check back on your progress next time you come to clinic, and then maybe you can progress further and further, and I can give you more challenging exercises.
Perfect, sounds good, thank you.
Sounds good. Thank you.